Washington rocked as news breaks. UnitedHealth, America's largest insurer, is under Department of Justice criminal investigation for $8.7 billion in alleged Medicare fraud. Senator Grassley is demanding answers. How did billions for seniors vanish into a system designed to help, not deceive? If corporate insiders found a way to turn patient codes into payouts, what else is hidden behind boardroom doors? The scheme is bigger, and the stakes higher than anyone imagined. On July 24, 2025, UnitedHealth Group, the largest health insurer in the country, filed a notice with the Securities and Exchange Commission confirming it was under formal investigation by the Department of Justice. The company admitted it had begun complying with both civil and criminal requests from federal authorities. This disclosure followed weeks of mounting speculation as CNBC and other major outlets reported the Department of Justice's criminal probe into allegations that UnitedHealth secured $8.7 billion in fraudulent Medicare Advantage payments in a single year. The $8.7 billion figure isn't just a corporate accounting error. It represents enough money to cover hundreds of thousands of hospital stays, drug treatments, or home care visits for seniors across the country. According to the Department of Justice, the focus is on how UnitedHealth recorded patient diagnoses that triggered extra federal payments, raising concerns of systematic overbilling on a scale rarely seen in American healthcare. UnitedHealth's SEC filing marked the first time the company publicly acknowledged the scope of the investigation. Until then, the insurer had denied being formally notified of any criminal inquiry. But as of late July, the company could no longer keep the probe out of the public eye. The question now gripping Washington: how did billions in taxpayer dollars, intended for senior care, end up in the coffers of a single corporation? And if such a massive fraud could go undetected for years, what else has the system missed? The answer begins with understanding exactly how Medicare Advantage payments can be manipulated, and why the Department of Justice believes this is more than just a paperwork mistake. Medicare Advantage was designed to reward insurers for taking on sicker patients. The government pays more for higher-risk enrollees, using a formula where each diagnosis adds to a patient's risk score. This number is supposed to reflect real medical need, but in practice, it's become a powerful lever for profit. UnitedHealth's approach centered on two main tools: in-home health assessments, known as house calls, and aggressive chart reviews. Nurses and clinicians would visit patients at home, sometimes finding conditions that their regular doctors had never noted. Afterward, coding specialists combed through medical records, searching for any diagnosis that could justify a higher risk score. Even when a patient's day-to-day care didn't reflect a serious illness, a single added code could mean thousands of extra dollars in federal payments each year. The results were stark. Over a 3-year period, risk scores for patients seen by UnitedHealth's own physician groups shot up 71%. By comparison, traditional Medicare patients saw just a 12% increase. That gap isn't explained by a sudden epidemic of illness. It's the product of a system where coding decisions drive revenue, not just care. Every risk factor, every diagnosis, real or questionable, multiplied the money flowing from Medicare to UnitedHealth. The more conditions recorded, the higher the payout. This wasn't random chance. It was a deliberate strategy, engineered through internal protocols, software prompts, and sometimes financial incentives for clinicians and coders. The numbers on paper became the numbers in the bank, with billions at stake for the company and for taxpayers. On February 24, 2025, a letter landed on the desk of UnitedHealth Group's CEO. The sender? Senator Chuck Grassley, chair of the Senate Judiciary Committee. His message was blunt and unmistakable. Grassley accused UnitedHealth of apparent fraud, waste, and abuse, warning that the company's billing practices had crossed the line from aggressive coding into outright taxpayer deception. He demanded answers, not just from UnitedHealth, but from the Centers for Medicare and Medicaid Services as well. Grassley called for a full accounting, of how so much money, billions meant for patient care, could have been siphoned off through what he described as systemic abuse. His letter referenced years of ignored red flags, from federal audits to whistleblower lawsuits, and insisted that both the company and regulators explain how such widespread overbilling could escape detection for so long. Grassley's words carried the weight of official oversight. He wrote, "Despite these oversight efforts, Medicare Advantage organizations continue to defraud the American taxpayer, costing them billions of dollars a year. The apparent fraud, waste, and abuse at issue is simply unacceptable and harms not only Medicare beneficiaries, but also the American taxpayer." This wasn't a quiet inquiry. Grassley's letter was a public demand for accountability, putting UnitedHealth and the entire Medicare Advantage system under the harsh light of congressional scrutiny. For years, industry leaders had operated behind closed doors. Now the questions were coming from the Senate itself, questions that demanded real answers, and not just for the sake of political theater, but for every taxpayer and senior whose care had been put at risk. Federal oversight agencies have been sounding alarms about Medicare Advantage overpayments for years, but the warnings rarely translated into decisive action. In 2018, the Office of Inspector General flagged widespread risk score inflation across the industry, estimating that questionable diagnoses had pushed government payouts far beyond what patient care required. By 2021, the cumulative total of these excess payments had reached $50 billion, enough to fund major improvements in hospitals and clinics nationwide, or to provide life-saving treatments for countless seniors. Audits by the Centers for Medicare and Medicaid Services consistently identified patterns where insurers, including UnitedHealth, added diagnoses through in-home assessments and chart reviews. These findings weren't buried in obscure reports. They appeared in public documents, press releases, and even congressional briefings. Yet, despite the evidence, enforcement remained limited. Civil settlements and compliance agreements became routine, but the underlying practices continued. Whistleblower lawsuits added to the chorus, with former coders and clinicians describing internal systems designed to maximize risk scores, sometimes at the expense of clinical accuracy. These suits, filed under the False Claims Act, allege that the drive for higher reimbursement was baked into company policy. Not just an error, but a business strategy. The $8.7 billion at the heart of the current DOJ probe is only a fraction of the broader problem. When federal auditors estimate $50 billion in questionable payments in just 3 years, it's clear the issue reaches far beyond one company. Each ignored warning, each audit left unenforced, allowed the problem to grow, costing taxpayers and undermining trust in a program millions rely on. 66,000 UnitedHealth Medicare Advantage members were diagnosed with diabetic cataracts after they had already undergone cataract surgery, a medical contradiction that eye specialists call impossible. Cataracts, once removed and replaced with an artificial lens, do not return. Yet for these seniors, their records showed a condition that could not exist, all because a billing code was entered. Every one of those entries triggered extra federal payments, dollars meant to support real care for real patients. Behind each number is a person, someone's mother or grandfather, whose medical file became a tool for profit. The harm isn't just on paper. When records are filled with false diagnoses, patients can face confusion, denied claims, or delays in getting the care they actually need. For tens of thousands, what happened in a spreadsheet had consequences in the doctor's office and at home. Federal law gives prosecutors a powerful tool: the False Claims Act. If UnitedHealth is found liable, the company could face treble damages, meaning repayment of up to 3 times the government's losses, plus additional penalties for each false claim. With $8.7 billion in question, the financial risk is staggering. As the investigation deepened, UnitedHealth's response grew louder. The company issued a statement calling the allegations outrageous and false, insisting its billing practices follow Medicare rules. But while denying wrongdoing, UnitedHealth doubled down on political influence. In just the first half of 2025, the company spent $7.67 million on federal lobbying, more than ever before. Its advocacy team doubled in size, working behind the scenes as federal scrutiny mounted. The legal and political battle lines are drawn, but answers remain elusive. The Department of Justice has confirmed an $8.7 billion fraud investigation into UnitedHealth, with criminal and civil probes launched after years of audit warnings and whistleblower claims. Senator Chuck Grassley's February 2025 letter labeled the case as systemic abuse and demanded answers for what he called taxpayer deception. Despite UnitedHealth's denial of wrongdoing and nearly $8 million spent on lobbying in 2025 alone, evidence from government audits and patient records points to widespread risk score inflation, where conditions were exaggerated and 66,000 post-surgical cataract codes cannot be explained by clinical data. While the DOJ investigation and Senate hearings continue, many internal documents and communications remain classified, and the full extent of patient harm is still being assessed. What is clear? Unchecked fraud drains resources from Medicare, impacts real patient care, and erodes public trust. As Senator Grassley stated, taxpayers deserve accountability. The fight for transparency and reform in Medicare Advantage is not over, and the facts demand continued vigilance.